Hello, and welcome to the 2019 Public Employees Benefits Board Annual Open Enrollment Presentation for employees. The PEBB Annual Enrollment Period is from November 1st to the 30th, 2018. In addition to this video, you can find open enrollment information at the PEBB webpage for employees. It can be found at www.hca.wa.gov/PEBB, PEBB, -employee, EMPLOYEE. In addition to the website, you can find information in the October edition of the 4-Year Benefit Newsletter, which was mailed out or emailed out on October 12, 2018. Do understand that that was your only enrollment notice for 2018. The PEBB program offers benefit fairs from October 30th through November 19th. At the fairs, you have the opportunity to speak in person with PEBB program representatives, health plan representatives, and PEBB contracted vendors. We will be offering 22 fairs statewide. Some of the fairs include presentations on the medical flexible spending arrangement or the dependent care assistance program. Those will be provided by Navia Benefit Solutions. The UMP Plus plans will also be providing presentations at some of the fairs. You can find the dates, times, and location of these presentations in your October newsletter. In addition to the fairs where you can meet people in person, PEBB will be offering a few webinars that you can participate in. The UMP Plus networks will be hosting webinars. Specifically on October 29th from noon to 1 o'clock will be the Puget Sound High Value Network. On November 7th from noon to 1 o'clock, the University of Washington Medicine Accountable Care Network will be providing a webinar. You can register for either of the webinars at the PEBB Open Enrollment webpage. See the link below. Navia Benefit Solutions will also be providing webinars on the medical FSA and DCAP programs. They will be held on November 7th, 13th, 15th, and 28th. Each session begins at 1 o'clock. You should pre-register. Remember that the PEBB Medical FSA and/or DCAP is only available to PEBB benefits eligible employees of state agencies and higher education institutions. So, what can you do during open enrollment? Well, you can change medical and/or dental plans. You can reinstate previously waived medical coverage without a proof of loss. You can waive enrollment in PEBB Medical if you have either a TRICARE plan, Medicare, or other employer-based group medical. You can enroll or re-enroll in a medical FSA and/or DCAP. Understand that you must enroll or re-enroll each year during open enrollment in order to participate for the next plan year. That's even if you are not changing your contribution amounts. You still need to enroll or re-enroll each year if you wish to participate. In addition, during open enrollment, you may add eligible dependents without proof of loss. However, dependent verification documents may still be required if you are enrolling a dependent who has not been previously verified. You can find a list of valid dependent verification documents at the PEBB website. In addition, you can remove dependents from your PEBB medical or dental plan. You can change your premium deduction to pre or post-tax. You can change the tax status of a dependent. You can also attest or reattest to the premium surcharges if they apply to you. For 2019, the tobacco use premium surcharge will remain at $25 per account per month. Remember, you can attest to the tobacco surcharge at any time as well as during open enrollment. The spouse or state registered domestic partner coverage premium surcharge will also remain at $50 per month for 2019. There are some changes you can make online through the My Account program. You can start making those changes November 1st. However, any changes made online must be completed by midnight on November 30th, 2018. In addition, you can use paper forms. However, your agency's personnel, payroll, or benefits office must receive the forms no later than November 30th, 2018. As a reminder, any changes you make during November or open enrollment become effective January 1st of 2019. A note, University of Washington employees must use the Workday program to make their changes. You can make changes online via My Account at www.hca.wa.gov/PEBB-employee. Look for the green icon in the upper right-hand corner of the page that says My Account. The following are changes that you can make online during open enrollment. Change your medical or dental plan. Remove a dependent from your medical or dental plan. Waive or enroll in PEBB Medical. And attest to premium surcharges if they apply. Changes made online in My Account will show as pending a January 1st date. They will not display as a change until 2019. In addition to making those changes, you can view or print a statement of insurance in My Account. You can sign up for the PEBB program's email subscription, and you can view your enrolled dependents. You can view your medical and dental plan enrollment, the long-term disability insurance, premium surcharge attestations, and your basic life and accidental death and dismemberment insurance. Understand that if you have optional life insurance, you would see that information in your account at the MetLife website. Again, a reminder for University of Washington employees, you must use Workday to make any changes. You do not have access through My Account. Use Workday to make the changes, and attempting to log into My Account will result in an error message. What are changes that you cannot make in My Account? You cannot add a dependent to your PEBB medical plan. You must use the 2019 Employee Enrollment Change Form. In addition, you must provide proof of the dependent's eligibility with the enrollment form. You can enroll or re-enroll in the medical FSA and/or DCAP by submitting the form to Navia Benefit Solutions or enroll at www.naviabenefits.com. So how can I get a form? You have a couple options. You can ask your personnel, payroll, or benefits office staff, or you can go to the PEBB website, click on the Forms and Publications webpage. Open enrollment forms will be available starting November 1st. What if I'm not making any changes for 2019? Well, as long as your medical and dental plans are still available in the area where you live, you will remain enrolled in your current plans. Are there changes that I can make outside open enrollment? Remember that at any time during the year, you may enroll in or make changes to optional life and accidental death and dismemberment insurance, optional long-term disability insurance, and auto and home insurance. Understand that for the life and LTD insurance, carrier approval may be required in order to make those changes. Premiums for 2019. State agency and higher education employees can find their premiums in the October edition of the 4-Year Benefit Newsletter, or you can visit the PEBB website. The employer determines the premium for employees that belong to K-12 Washington school districts, educational service districts, and charter schools, as well as counties, municipalities, tribal governments, and other employer groups. Employees of these employers should contact their agency's personnel, payroll, or benefits office for their premium information. PEBB dental plans. The same dental plans are available for 2019 as for last year. PEBB continues to offer the Uniform Dental Plan, Delta Care, and Willamette Dental. The one change in dental plan coverage this year is with the Uniform Dental Plan, which will be reducing the limit on Class 3 restorations or crowns from 7 years to 5 years. As a reminder, Delta Dental of Washington administers both the Uniform Dental Plan and Delta Care. Remember, the networks of these two providers are different. Call your plan directly to verify which network your dentist participates in. The number to call for Uniform Dental Plan is 1-800-537-3406. For Delta Care, 1-800-650-1583. PEBB medical plans. The same plans are available for 2019 as last year. PEBB offers Uniform Medical Plan, Kaiser Permanente Washington, Kaiser Permanente Northwest. But do caution that there are some changes in the service areas for these plans for 2019. Kaiser Permanente Washington offers the following plans: Classic, Consumer Directed Health Plan with a Health Savings Account, or CDHP with HSA, Sound Choice and Value. Kaiser Permanente Northwest offers the following plans: Classic and CDHP with an HSA. The Uniform Medical Plan offers the following plans: Classic, CDHP with an HSA, and 2 UMP Plus networks, the Puget Sound High Value Network and the University of Washington Medicine Accountable Care Network. Plan availability for 2019. Understand that plan availability differs by plan type and your place of residence. There are some changes for 2019. See your October for Your Benefit newsletter for the specifics. In addition, information on plan availability can be found in the 2019 Employee Enrollment Guide, as well as the PEBB website on the Medical Plans Available by County page. UMP Classic and UMP CDHP with an HSA are available to subscribers worldwide. The UMP Plus plans for 2019 will no longer be offered in Grays Harbor County. The UW Medicine Accountable Care Network is available in the following select counties in Washington: King, Kitsap, Pierce, Skagit, Snohomish, and Thurston. The Puget Sound High Value Network is available in these Washington counties: King, Kitsap, Pierce, Snohomish, Spokane, Thurston, and Yakima. Kaiser Permanente Northwest offers the Classic and CDHP with HSA plans. They are available in select counties in Washington and Oregon. There are some new counties for these two plans in 2019. Zip code 97456 in Benton County, Oregon. Several new zip codes in Lane County, Oregon, as well as all of Lynn County in Oregon. Kaiser Permanente Northwest Classic and CDHP with HSA plans are being removed from the following zip codes in Oregon for 2019. Zip code 97028 in Clackamas County and zip code 97350 in Marion County, Oregon. Kaiser Permanente Washington Classic, CDHP with HSA, and value plans are available in select counties in Washington, Oregon, and Idaho. However, the following counties and zip codes will be removed from Washington for 2019. Zip code 99009 in Pend Oreille County, and zip codes 99006, 99026 in Stevens County. The Kaiser Permanente Washington Sound Choice Plan is available in select counties in Washington. There are a couple new counties for the Sound Choice Plan for 2019. They include Kitsap County and Spokane County. Please note that not all Kaiser Permanente providers in Spokane County will be in the Sound Choice network. Make sure your provider is in network by calling the plan at 1-888-901-4636, or you can visit the KP website at www.kp.org/WA/PEBB. Medical plan benefit changes for 2019. For Kaiser Permanente Washington, all plans, there will be a new customer service number specifically for PEBB members. Effective January 1st, 2019, you should call 1-866-648-1928. For questions before January 1st, please continue to call 1-888-901-4636. In addition, Kaiser Permanente Washington will be offering a virtual diabetes prevention program to all non-Medicare members. The Kaiser Permanente Washington Sound Choice plan does have a few changes for 2019. They have lowered the deductible. For 2019, the deductible per person will be $125. For a full family, it will be $375. They've removed the cost share for primary care visits, which used to be 15% coinsurance. And there's also now a $500 inpatient hospital services copay per admission, which used to be formerly $200 per day or up to $1,000 maximum. In addition, Sound Choice plan members will be getting new ID cards, and they will also be providing a separate visit limit for massage therapy of 16 visits per year. Formerly, the massage therapy was combined with occupational, physical, speech, and neurodevelopmental visits for up to 60 per year. The Uniform Medical Plans will be offering a virtual diabetes prevention program for non-Medicare subscribers. They will also be offering a new Spinal Care Centers of Excellence program to qualifying members of UMP Classic and CDHP with HSA plans. In addition, UMP will now be covering male condoms at 100% with no deductible for UMP Classic and UMP Plus members. They will be available at 100% after meeting the deductible for UMP CDHP with an HSA plan member. Medical Plan Reminders. If you are enrolled in a consumer-directed health plan with a health savings account, the employer contribution to an HSA for 2019 will remain the same, $700.08 per year for an individual, $1,400.04 per year for a family. A family is considered an employee and one or more dependents. Do note that the IRS maximum contribution amounts to an HSA are changing for 2019. For an individual, the maximum amount is $3,500. For a family, it's $7,000. If you are age 55 or older, you can contribute an additional $1,000 per year. Please note that your employer contribution, along with any of your contributions and wellness incentives if earned, count towards the IRS maximum amounts. If you are currently enrolled in a CDHP with an HSA and you will be turning age 65 in 2019 and you plan on enrolling in Medicare in 2019, you should consider changing your medical plan. Seek professional tax advice before remaining enrolled in a CDHP with an HSA plan. The IRS can impose a penalty, and Medicare can be retro-enrolled up to 6 months unless a specific request is made to Medicare. Life in AD&D and long-term disability insurance. There are no changes to benefits or rates for 2019. Please note, though, there will be a special one-time LTD open enrollment period in early 2019. The special open enrollment period will allow for enrolling in optional coverage without providing evidence of insurability. Please see the announcement in your October for your benefit newsletter, and more information will be coming to you in early 2019. If your employer offers PEBB medical insurance only, understand that life, AD&D, and LTD insurance is not available to you. Contact your agency's personnel, payroll, or benefits office if you have questions. PEBB Premium Surcharge Attestations. The tobacco use premium surcharge. Remember, subscribers only need to attest when you or an enrolled dependent has a change in tobacco use, you return from waive status, or you enroll a dependent age 13 or older in PEBB Medical. You can visit the PEBB website to find the 2019 Premium Surcharge Change Form, when the premium surcharge does not apply, and a listing of tobacco and non-tobacco products. As to the spouse or state-registered domestic partner coverage premium surcharge, you may need to reattest if you attested in 2018 and you will enroll a spouse or state-registered domestic partner on your PEBB Medical for 2019. How can you find out if you need to attest? The PEBB program will be mailing a letter to subscribers who need to reattest in late October. You can also use My Account starting November 1st to see if you need to attest. And you can ask your agency's personnel, payroll, or benefits office. You can attest or reattest during the PEBB program annual open enrollment online through My Account, again, no later than midnight, November 30th. Or you can submit a 2019 premium surcharge change form. But do note that that form must be received by your employer no later than November 30th. And again, a reminder, University of Washington employees must use Workday to make these changes. If you are required to attest and you don't within the deadline, or if your attestation results with you incurring the premium surcharge, you will be defaulted to incur the $50 monthly surcharge in addition to your monthly premiums. It will be effective January 1st, 2019, and will remain in effect for the rest of the year. Your next opportunity to attest or change your attestation would be when a special open enrollment event occurs, and you can see the PEBB website for a listing of SOE events and what changes may be allowed. Or you can reattest during the next PEBB program annual open enrollment. In addition, you may file an appeal through the appeals process. Smart Health. Smart Health is the state's voluntary wellness program. Only subscribers can qualify to earn the wellness incentives, which are a $125 reduction in the 2020 employee's medical deductible, or a one-time deposit of $125 into an HSA if enrolled in a CDHP with an HSA plan. An additional incentive is a $25 Amazon.com gift card for completing the well-being assessment. Spouses or state-registered domestic partners enrolled in PEBB Medical may participate through the Smart Health website, but they are not eligible for the financial wellness incentives. To learn more about Smart Health, visit www.smarthealth.hca.wa.gov. Some reminders for open enrollment. You must enroll or re-enroll each year during open enrollment in order to participate in a medical FSA or DCAP for the next plan year, even if you are not making changes to your amounts. Also note, you may not enroll or re-enroll in a medical FSA if you or a spouse or state-registered domestic partner is enrolled in a CDHP with an HSA in 2019, or if you will change to a CDHP with an HSA plan in 2019. 2018 medical FSA enrollees who do enroll in a CDHP with an HSA for 2019 must use all of their funds and have all their claims paid by Navia Benefit Solutions by December 31st, 2018. If all of your medical FSA funds are not used and all claims paid by December 31st, 2018, No contributions, employer or employee, may be made to your HSA account until April 1st of 2019. Contact information. Contact your plans directly for help with benefit questions, ID cards, claims, making sure your doctor or dentist contracts with the plan, choosing a doctor or dentist, and making sure your prescriptions are covered. Contact your agency's personnel, payroll, or benefits office directly for eligibility questions or changes, enrollment questions or procedures, premium surcharge questions, finding forms, adding or removing dependents, life and LTD insurance eligibility enrollment questions, and payroll deduction information. Thank you for watching.